Test 1, 2, 3.
Okay?
Test 1, 2, 3.
It looks like it's working. Okay, I'm going to admit everyone. Are you ready?
Ready?
On three. I'm going to count down for 3. 3, 2, 1. We're live.
Well, good morning. I see Bob Caldwell's name. I don't know. Are we on right now? Hopefully. Hey, folks. Thank you very much for joining our Zoom call today. We are here to talk about what we would like to see from business and to work with business with regard to the response for this coronavirus. So what we're really asking for is people to be able to take their organizations and do the same sorts of planning that we are doing at the state of Nebraska. So at the state of Nebraska, we work together with all my departments to start working on continuity planning. How are we going to handle our associates? We want you to think about things such as, again, if somebody shows up to work who has been identified, who's not feeling well, send them home right away. If you've got associates who have kids who are home from school, make sure that you're being flexible with their teammates with regard to work hours, maybe work from home options, things like that. So I think businesses need to be prepared. For example, if maybe half of their teammates can't show up for work on a given day. You also need to communicate out clearly, develop these policies and communicate them out clearly to all the folks that you have working for you. We just had a press conference where we were talking about the school districts and how I'm going to be approaching closing school districts. It will be based upon a general rule of thumb of 1 to 2 cases in Lincoln where we can't trace where they're coming from, or 2 cases in Omaha. And then we're going to break down the state by ESUs, those geographical educational service units. And if we have a case where we can't track in those ESUs, we will start making the decision to close the schools in those ESUs and other large public gatherings. So businesses need to be prepared for these sorts of things and be mindful that they may have people who have to take care of their kids. How are you going to manage that? And I think the important thing is to create certainty with your workforce. Let them know ahead of time of how they're going to be treated. And we'd especially like you to take care for your hourly folks. Think about how they're going to be impacted if they can't come into work and how they're going to be able to take care of their families. Think about your travel. Really consider banning all your non-essential travel around the country because the cases we have of coronavirus here in our state are all related to travel cases. So those are the sorts of things we're really soliciting the help of business to be involved with. You've got important organizations all across our great state. We're working together with the state to really coordinate and work together with our public health officials at the state level, at the local level, at the federal level, our school districts, the university system. All of that, we want to be together as one team that is working to make sure we're slowing down the spread of this coronavirus. And so with that, Brian, I'm going to turn it over to you to be able to talk a little bit as well.
No, I think that hits many of the highlights. I think, Governor, as we were talking this morning, the scope and timing of this really depends on the planning steps that people are taking now. And if I could urge businesses to do one thing, it would be to over-communicate on this issue. I know most of us have issued communications within our companies to our employees in the past. This has been something we've been talking about and planning about for several weeks. That communication process needs to continue because in many respects this is going to be a little bit of a moving target. And certainly if a school district closes where you have a significant operation, you could find in a very short order a very significant change in the makeup of your workforce. And it's really important that everybody has a plan, that plan continues to evolve, and that we have the flexibility. And I know within different industries within the chamber, it's going to be different answers. Some jobs can be done at home, some cannot. Sometimes it's going to be differences in approaches to shifts, sometimes it's going to be segregating teams. But it's really important that the businesses have plans. And Governor, I think that the most challenged will be the smaller businesses. With a handful of employees, how do you deal with this? The one thing I would say is make sure that particularly in smaller businesses, and all businesses should have this, but really important in small businesses, have a plan for what happens if a teammate in your small business becomes infected and that has been exposed to everyone in your business. What is the protocol? How are you going to deal with that? And what I urge you most in this instance to do is make sure that you talk to your local health department as you develop a plan around that. What are the resources that you're going to use? What are the protocols you're going to take place? And have that plan in place. It's not something you want to deal with on the fly. because it's not going to be difficult. And most of all, our most important asset, the most important resource in Nebraska is our people. We all know that workforce is always our number one issue. Take care of your workforce first. Make sure that if they're sick, don't have them come to work. If they do come to work sick, please send them home. And if we can get on top of this, I think we certainly limit the scope and duration of this process.
Yeah, and I think that's a great point about having people plan. So for example, if you look at what happened at Methodist with patient one,
Yep.
30 plus people were exposed and had to self-quarantine at home to see if they were going to develop symptoms. So that's the kind of thing that may happen at a business if you have somebody who in your workplace is identified test positive for the coronavirus. So I think it's important right now to emphasize that we don't have any of these cases. We only have 13 total identified cases in Nebraska. We don't have any cases we can't track right now, but that could change. And again, what we're really looking to do is slow down the spread of the virus here. It's like the flu. This is something that, you can't stop the flu from coming. So this is something that we are all going to be dealing with. Now is the time to be making those plans before we get to the point where we've got that community-wide spread.
And I think we talked a little bit about it in the press conference this morning. There's a lot of fear out there and a little bit of panic in some instances. And the key to that is making sure our employees have the best and current information.
Yeah.
And all employers should be providing current information. The Department of Health and Human Services is publishing the most current information, the CDC, and we'll also be publishing information on our chamber website, resources for you to use. But I think it's important to keep this communication process going with our employees so we stay on top of it.
Yeah, on that note, maybe that's a good opportunity for me to talk a little bit about what we know about this virus, which is that it is a virus that primarily impacts people who are older or people who have an underlying health issue. So for example, young people tend to weather this very well. To my knowledge, we don't have any pediatric fatalities in our country right now because of this disease, and that's pretty typical of what we've seen in other countries as well. So, but who it does impact is our elderly. People who are 80 and older are very susceptible to the fatalities with regard to this virus. People who have like respiratory disease, pulmonary disease, other diabetes, other underlying health conditions like that are going to be very susceptible to this. So again, in your workplace, you may want to think about, well, who are those people that we have in our workplace that are going to be most at risk? If you've got a 20-year-old, that's not going to fit the profile of the person who's most at risk. If you've got somebody who's 70 in your workplace, however, that person's going to be at more risk. Or if you have somebody with diabetes or something like that, in those underlying health conditions, this is really an opportunity to think about who you have in your workforce, how do they need to all be treated differently based upon their individual condition.
And I think as we look at businesses, I know, Governor, in my own case, and you said, but we both have jobs that require lots of handshaking and lots of meetings.
Yeah, don't do that.
And we just simply have to change how we conduct our business here for a while.
So you saw that. So we just had this big press conference where we're going through all the things about schools and university and social distancing and what we're going to do to, when we're going to start shutting things down. I'm walking out, and one of the superintendents tries to shake my hand. I'm like, we just covered this. We don't do that anymore. We do the elbow bump. Cough into your elbow or a tissue. Make sure you throw it away. Distance yourself. Again, it's a respiratory disease, so it gets spread through droplets. It's about a 6-foot radius. So if you stay in that social distancing, 6 feet away from somebody, very, very low risk that you can actually transmit it to somebody else.
Yeah, and so I think at this point, our best defense are the simple things: washing hands, keeping that distance. Using teleconferences and other forms of communication where you can, and not organizing big meetings among your workforce if you don't have to.
Right.
Clearly, business has to go on.
Yeah.
And so there are certain realities of business, and we all understand that. But to the extent that you can, protect your employees by doing things just a little differently, including yourself, for the next several months.
And again, there are no vaccinations for this yet, though UNMC is working on clinical trials already. There's no treatment specifically for this yet. Our best defense are those things that Brian was just talking about, that social distancing, making sure you keep that distance between yourself and other people, that 6 feet space. Again, that really makes a huge difference. Wash your hands frequently for 20 seconds at a time. Singing happy birthday twice actually works if you can't count to 20. So these are the kind of things that you can do to make sure you're really minimizing the spread. Wipe down surfaces. If you, again, limit travel, if you're gonna go if you have to have people travel overseas, check the State Department website, check CDC's website, check the Department of Health's website. There's lots of great resources out there that are official sources about what you should be thinking about. But again, it's these non-pharmacological interventions that we all can do that will have a huge impact on how we slow the spread of the virus.
Yep. And then lastly, what I would urge all businesses to do is develop a continuity plan. Identify those specific areas in your operation where 1 or 2 or 5 critical people were not there, but it's a critical function in your operation. How would you go about that? Would you outsource it? Do you have a fallback for that? And the classic example in my own case, Governor, is I am restricting our 2 lobbyists from any behavior that would be in big crowds for now, because they're really essential to what we're doing with the legislature right now.
Right.
But being able to identify those areas of your operations that are absolutely mission critical that you need to have a contingency plan for.
Right, great. Well, should we open up the questions and answers?
Yeah.
All right.
Governor Brown, we've got a question from Denise from Norfolk, and she's wondering what communities should do right now about large events, community banquets that are upcoming.
So with regards, again, what we'll do at the state level is that when we reach that threshold of about, as we approach 1% of the population getting the virus, we will shut down schools and large events for a period of 6 to 8 weeks. However, there is nothing that prevents anybody from being more conservative than that. So for example, if you've got a gathering of over 250 people, I'd ask you to reevaluate that, if whether or not you really need to have that gathering of more than 250 people, or if you can skinny it down to less than 250 people. When we get to the point where we're declaring an emergency for a given area and we're shutting down schools, then we will ban gatherings from anything above 20 to 50 people. So that's kind of the guidelines that we're going to be issuing. So again, right now, we really discourage anything above 250. When we declare that emergency, it's anything above 50 is going to be off limits, and it'll really be 20 to 50 that we start making those judgments. So that's kind of the ballpark there right now. Again, people are always welcome to be more conservative, take greater steps. It really gets back to how great a need is there. What's that cost-benefit trade-off? Do you really need to have this public gathering, or is this something that can be put off till another day?
All right, Governor, we have a question from Madonna in the York area about local businesses. They're seeing some of the residents, stay home with concerns about the virus. What message do you have for them as they experience lower foot traffic?
Yeah, again, I think this is one of the things that businesses will have to traffic to, is questions about impact on local businesses. With regard to, what's going on and so forth. We don't have that spread in the community right now we can detect. So again, we're using that rule of thumb of 1 to 2 cases, depending on your community. Then we'll kind of know that we think maybe we're approaching that 1%. But we don't have that right now. So what I would encourage people to do is you can still go about your regular life with the kinds of precautions we have said with regard to social distancing. I went out to eat with my family on Wednesday night. We went to a restaurant here in Lincoln. I'm going out to dinner tonight. So those sorts of things are still possible right now. People don't have to stay home unless they feel uncomfortable, but right now you can still go do that sort of thing. And we expect, as Brian said, business will have to continue. Take those good social distancing precautions and just communicate that out to the folks in your community that you're taking those steps so we can all address how we slow this virus.
Dawson from McCook has a question about SBA and request for disaster relief lending. Has the state issued a request for that relief to start at this time?
So one of the things we heard from the president is that the Small Business Administration has been tasked with being able to provide liquidity to small and medium businesses to be able to help through this crisis. Please reach out to my Department of Economic Development. We have not received any specific guidance right now from the federal government with how to do it. But if you contact Tony Goins or somebody in his department, we will work with you with regard to how we make sure that your business can be able to see if it qualifies and see what you have to do to apply for those dollars.
Well, Governor, I want to thank you for doing this today. It's very helpful for us, and also thank you for your leadership on this. I think we're already seeing in some of the other countries aggressive leadership steps to contain the virus at the beginning certainly looks like it's having a payoff and it's shortening the cycle. And so everything that you're talking about, and everything that you've organized so far, I just think businesses are going to be affected by this, and I don't. There's no other way we can put it. Having those plans, communicating, being connected to your government resources is going to be important.
Yep.
We have one last question, and that's coming in about school decisions. So are local ESU units making decisions on school closings, or is that being made at the local school district level?
Yeah, so let me talk a little bit about school closings, because we just had a press conference on this. As I mentioned, at the state level, what we are doing is we are looking at those cases where we cannot track how they got the virus. They're called community cases. When we have 1 or 2 of those in Lincoln, 2 of those in Omaha, 1 within an ESU geographical area, that's when we are going to make the decision to close down schools in that ESU. So, for example, Omaha and Lincoln are both their individual ESUs. If it's an ESU someplace else in the state, one of our 17, we'll make that decision again based on the judgment. If it's on borderline between 2 geographical units of ESUs, we may close down schools in both. That's something we, the state, will be doing. Okay? When I make that decision, it will be done for a period of 6 to 8 weeks. Now, schools can make decisions to close independently of what I am doing. So, for example, we saw that with Fremont. When patient 1, our first patient with coronavirus, was detected and it had been determined that she had been at a basketball game in Fremont at the YMCA, the Fremont Public Schools decided that they were going to take that opportunity to close down to be able to reevaluate. That is perfectly appropriate. I support all of our school districts who are making that decision with regard to their unique circumstance to protect the health and safety of the kids, their parents, and frankly the grandparents, because that's what this is really about. When we close a school, it's really not about the kids. Kids will weather this very well. It's really about protecting their grandparents by slowing the spread of this virus. About 5% of the people who get this virus will have to go to the hospital. We do not want to overwhelm our healthcare systems by having all those people go at once. So we want to spread this out and slow it down. And so school districts will make that decision like Fremont did, and I support those 100%. So your school district may decide locally to do that. We at the state, at some point, will make that decision on a larger scale. When we make that decision, it will be based on the criteria I told you, and it will be for about 6 to 8 weeks.
Governor, on a related note, we had one more question come in from Phil in Papillion on church worship services, synagogue services. Any guidance there?
So again, right now, I would encourage that if you've got a congregation that's larger than 250, that you think about how you can maybe have more services, get that number down so that you don't have as many people in one place at a time. That's going to be a voluntary guidance that we have got coming from the state. When we get to the point that, say, in the Omaha area, we've got those 2 cases that we cannot track, and so I declare an emergency and shut down schools, that means large public events. So if you've got a worship service that is going to have regularly 200 people, you're not going to be able to do that with 200 people. We really want you to skinny that down to something less, those gatherings. If you've got a company, say you've got a company meeting where you've got people coming in from all around the country, right now I'd recommend you keep it below 250. When I declare that emergency, you're not going to be able to have it more than 50. So again, what we're really trying to do is avoid those mass gatherings where people can get together in very close proximity and spread the virus, because again, it's got about a 6-foot range through those droplets. If you can spread it out more than that, that's going to be a much better situation. So that's why we really want to, once we get to the point where I'm declaring an emergency, we're really going to say, hey, if you're above 50 people, we really don't want you having that service. Well, again, folks, thank you all very much. I appreciate you taking the time to be on this call here. We will continue to communicate with regard to what we're doing here at the state level as we address this virus and how it's impacting our state, whether it's impacting our schools or impacting our businesses. But we really want you to all to be a part of this. Everybody can be a part of limiting the spread of this virus by doing the common sense things we talked about with regard to doing the elbow bump, washing your hands, and especially we want you to think about your businesses and how you are going to plan for this virus impacting them. Brian?
No, thank you, Governor. I would give you a handshake, but I don't think that's appropriate today, so thank you very much.
There you go. Great. Thanks, folks.